ये सबसे पहले फिजियोथेरेपी यानी पीठ को कुछ इस तरीके से थपथपाएं। इसलिए करते हैं क्योंकि ऐसा करने से पेशेंट का सिक्रीशंस इजली बाहर आ जाता है। इसके बाद हमें अच्छे से ओरल केयर कर लेनी है। ओरल केयर करने के बाद जो इनर कैनुला लगी होती है ट्रैकेस्टोमी ट्यूब में, उसे धीरे से बाहर निकालना है। इसके बाद हमें सक्शन कैथेटर से धीरे धीरे रोटेटिंग मूवमेंट में सक्शन करना है। ये सक्शन हमें 10 सेकेंड से ज़्यादा नहीं करनी है। जब अच्छे से सक्शन हो जाए तो हमें इसका ड्रेसिंग चेंज करना है। ये ड्रेसिंग हम इसलिए लगाते हैं ताकि पेशेंट का जो सिक्रीशंस, कफ और सलाइवा है वो डायरेक्ट पेशेंट के कांटेक्ट में ना आए। उसे अच्छे से सिक्योर कर लेना है। फिर ये जो इनर कैनुला है उसे वापस से क्लीन करके रिप्लेस कर लेना है। थैंक यू।
In this video, we're going to talk about suctioning a tracheostomy. Now, you may need to do this before you do trach care or just because the patient requires suctioning. Just make sure that you assess the patient before you start so that you know what their lung sounds are and what their oxygen saturation is before and after suctioning. So first thing you want to do is make sure your suction setup is working. You should have tubing attached to a canister attached to a regulator. For this, you want to set it on continuous medium suction. You also want to make sure that you can reach the end of the tubing. Sometimes I just lay it over the head of the bed or on the patient's chest. You can also loosen any oxygen device that they have at this point. So the first thing you want to do is open your sterile water container and just set the bottle on the table between you and the suction kit. Now you can open your suction kit and put on your sterile gloves from in that kit. Now, honestly, sometimes they're all bunched up and sometimes they have their own package. So depending on your kit, just be really careful to make sure that you keep them sterile.
Drape her neck and chest. Put on gloves and use a mask, gown, and face shield if splashing is likely. Fill a cup or basin with about 100 milliliters sterile water or sterile saline. Connect one end of the tubing to the suction machine and turn on the suction. Then connect the other end of the tubing to the Yankauer catheter. Verify that the suction mechanism is working properly by suctioning a small amount of sterile saline from the basin. If the patient has an oxygen mask, remove it, but keep it near her face. If she has a nasal cannula, leave it in place. Now insert the catheter into the patient's mouth, moving along the gum line toward the pharynx. Apply suction and move the catheter around the mouth